Hello, my name is Anna Grieve, and I'm here to talk about our project to develop a decision-making tool for fecal sludge treatment plants in emergencies. So thank you for the invite to give this espresso slot at your conference. So as I said, my name is Anna Grieve. I'm an associate in the water team for ARUP, a global engineering consultancy. We've been working closely with OXFAM on this project, and the key contact from OXFAM is Andy Bastable, who's the project manager from OXFAM's side. So this project is to develop a decision-making guide on fecal sludge treatment plants. So just to give you a bit of background as to why this tool is needed. So as you're probably aware, safe management of fecal sludge in emergencies is essential to protect public health. We wanted an easily accessible guide to help WASH practitioners decide which is the best FSTP, so fecal sludge treatment plant, to deploy given their context. There is a lot of evidence on FSTPs from Cox's Bazar that we've been collecting over the last couple of years, and this will be used as the evidence base to develop this tool. There are some existing tools on the subject, which we have done a review of. We found that in some cases they weren't specifically focused for FSTPs in emergencies and also covered FSTPs in development context, and that some of them were not easily accessible or easily usable given the type of data that WASH practitioners will have in the context. So we found that there is still a gap in the sanitation planning chain for a tool to help guide people on FSTP decisions. And then just to note that there were several other organisations developing similar tools, and that we thought that it was best to work together and via the FSM Twig, rather than going ahead and developing individual tools that perhaps aren't aligned. So on that basis, we're working with the Austrian Red Cross, Earwag, and the German Toilet Organisation, and the final tool will be hosted via SaniHub, and we're also making an effort just to make sure that it aligns with the Earwag Sani Choices tool and make sure that terminology is consistent. So to let you know the overall statement of intent for our project, so we're trying to improve decision making on FSTPs in emergencies in order to allow WASH coordinators as the key audience to make informed decisions on which is the best FSTP option for them. And the aim is to develop a simple tool that guides practitioners to the best solution given their context. We wanted to add value. Like I said, there are some existing tools, but we wanted to add value by developing a new tool. Some of the key limitations of existing tools were that in some cases it doesn't actually give you an answer. It says all types of FSTPs are unfeasible. So we're kind of filling that in. If there isn't a feasible answer, we will identify what the limitations are and guide people to the most suitable or closest choice that they can have, and also guiding people with the next steps of how to engage a professional designer if needed and how to engage with the supply chain for construction. We'll also be giving some links to practical examples. So I think the key things about our tool that we're aiming for is that it's simple, it results in a small number of answers, so 2 to 3 FSTP options will be given, but there will always be an answer, albeit perhaps with caveats, and that it will be largely based on field evidence collected in Cox's Bazar. There has been a gap analysis also done by the FSM Twig, which identified that there is this gap in the market for a FSTP decision-making tool and that further guidance was required on that. There were some recommendations on perhaps what the tool should include and splitting it up by acute phase and transitions phase. So you can see on the slide here some of the key criteria that we're trying to bring into each phase there. When we're looking at what the sort of selection criteria are for the FSTP, these are just some of the considerations that we're trying to bring into them at the moment. So one of the main ones being land footprint, we always find is a major constraint in refugee camps, so would be a key consideration. And then you can see there are other things around the robustness of the process, how well it actually treats the sludge given an unstable influent perhaps, how quick it is to set up and how easy it is to operate, as well as looking at the costs of systems. So we're at the moment we're working through what technologies we're going to include and how we categorize them within the tool. So these you see in the blue boxes there are the broad categories we've come up with, and the red are the types of technology that we're looking to include. And we might see systems with several of these technologies in one fecal sludge treatment plant, but that will be recommended by the tool where we're perhaps trying to target specific pollutions to remove and need a more complex system. So, as I say, the tool will be working towards an answer that is one of these technologies. We're just at the point of sort of developing the acute phase tool, and this is just an idea of what the formatting will look like. So it will be a web-based tool with drop-down menus to limit user errors, but also give users guidance where they don't have the exact data of how they could get it and what assumptions they could make. And then the intention is that it will spit out the 2 to 3 possible solutions and then give a checklist of what the user needs to do next to get it into design and construction, and also give some useful case studies for that type of FSTP. So thank you very much. And that was the key information on our project, just to show you the outline program for our project. So we're at the moment working to develop the actual tool itself before going into a validation and testing phase, when we're looking to disseminate the tool to the wash sector in August this year. Thank you very much for your time, and please let me know any questions. Thank you.